Health, according to the World Health Organization, is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So, healthcare advocacy is the process by which the actions of individuals or groups attempt to bring about social or organizational change on behalf of a particular health goal, program, interest, or population. It is a strategy to raise awareness and promote health and access to quality health care at the individual or community levels. How then would you rate healthcare advocacy in FCT? What are the challenges? What particular health goal should we be advocating for in the FCT? All these and many more are the basis of our conversation today on ABUJA File with Hawa Abbas. She is a public health advocate, a certified coach, and a humanitarian. We love ABUJA, and this is why we bring you events, reports, interviews, and everything relating to the FCT. This is ABUJA File.
Accept the nomination of our party.
All right, welcome back. And now we are at the office of Hawa Abbas. She's a public health advocate, a certified coach, and a humanitarian. Together, we shall be taking a look at health. Is it really wealth? Thank you so much for joining me on the program.
Thank you very much for having me.
Okay, you're a public health advocate, so you know this job.
Yes.
Help us understand what public health actually means.
Okay, so generally health is about looking about the physical, the mental, and the social. So for clinicians, they tend to look at the diagnosis of whatever the issue is, and then they focus on treatment. For public health, we tend to look more on the population. We try to look at, for example, lung disease. We now try to focus on what's the cause of the lung disease. What are the preventive methods we can take so that we can reduce the rates in a particular area. Which type of people are more prone to this lung disease? Is it smokers that are more prone? So that's what public health is really. It's more looking more the holistic part of health and how we can prevent, raise awareness, increase promotion about particular issues.
All right. You said how you can raise awareness. So sometimes, would you say the awareness is enough?
Awareness is key because, you know, in terms of advocacy, we're very big on advocacy. Awareness is key. When people are aware, they begin to understand the measures they can take to reduce or prevent certain illnesses. If people are aware, again, back to the lung disease, that if you are a smoker, you're increasing your chances of a particular disease or an ailment, then they begin to take some measures as well. Generally as well, you're aware that in your environment, if you keep your environment clean and safe, you're beginning to reduce other ailments such as maybe malaria. If you have an environment where you have water gathering, more mosquitoes are going to come to that area. If you're giving unclean water to your children, you can understand that we're going to have a rise of cholera in that particular community or area. Yes, so awareness is key. Awareness plays a big role in prevention in any health disease or issues that we're discussing.
Because I asked this question because I remember during, sometimes I'll take during the time of COVID-19, for instance, there was a lot of awareness, but people as little as refused to wear their nose mask. So that is one of the issues. And you made mention of other scenarios, taking care of your environment. You see still people throwing trash on the street and acting like it's not my business. It's not like they're not aware. You made mention of smoking and lung disease. Nigerians still smoke. So that's why I asked, is awareness enough? Because they know these things, but you still see people doing the things that they want to do.
I think that awareness is again important. However, understanding is also key. So, in giving people information, you also have to ensure that they understand the ramifications of not following the guidance they're given. So, if you tell somebody to keep this area clean because it's going to help improve the health of your household, but you're not explaining to them why it's going to help. Of course, they're not going to do it. During COVID, we had a lot of people having issues wearing masks because they said it was affecting their breathing. Now, for a lot of people, this was true. If you have asthma or other health ailments, it was true that they may have difficulty. But again, it was also the fear of unknown. We'd never had an issue where we were all required to wear masks as well. So, and then again, people didn't even believe in COVID, so they felt like wearing a mask was a waste of time. Again, it goes back to the understanding. If people understand the key elements of what you're trying to explain or what you're trying to prevent, they are more likely to adhere to the instructions or guidance you're giving them.
Oh, all right. With everything that you've mentioned so far, so how would you rate public health here in Nigeria? And I also want you to narrow it down to the FCT.
Public health in Nigeria is an ongoing effort by all the stakeholders. That's not Ministry of Health, private sector, NGOs, civil society, community health workers, and so forth. It's a continuous effort that involves all stakeholders to ensure the success of it. I believe that for certain issues or health conditions, Nigeria has done well. For COVID, we did not have as much casualties as other countries did. So the efforts for the country did actually reduce the deaths that were expected or predicted for Nigeria. If we narrow it down to FCT, example, I'll take immunization, for example. So immunization is doing really well in FCT. The efforts are continuous. I know that my organization, Silver Lining for the Needy Initiative, we're part of the committee that is working with the FCT to ensure that we follow up the coverage of immunization in all the primary healthcare centers and the communities, even communities that do not have primary healthcare centers. We are also working to ensure we go house to house to ensure that mothers, even in the rural areas where we have the Fulani settlements, we also go there from door to door, trying to explain and encourage them, and also let them know the ramifications or the consequences of not giving their children their full routine, complete immunization.
Oh, that's very beautiful. So with all of your awareness, how is it being received? Because it's one thing to teach or to explain to somebody, and it's another thing for the person to understand and actually implement what he or she has understood.
I think over the years, the response has gotten better. It gets better every year. We can say like over 10 years ago, the response was not as quick as we're getting now. The response is good. People are welcoming immunization, the routine immunization. Although there's still a few challenges, maybe challenges of getting to a facility, challenges of finding health workers in the facility, challenges of transport to get to the facility. But routine immunization is free, and we want everyone to understand that, so that when they do go to a facility, nobody's trying to charge them for what they're meant to collect for free.
All right. Now you've made mention of clinical treatment and all of that. Now let's go to a part where Nigerians don't really get it right, but in their mindset, they feel like they're doing the right thing. And that's where we come to local use of herbs and all of that. So in your line of duty, do you come in contact with situations whereby you're trying to make somebody understand this is what you should do and this is what is clinically right, and the person is trying to convince you that the herbal route is the right way, but you know deep down that this is wrong, but then the black mind mentality or mindset, like some people had during the time of COVID-19, they say this is not the kill black man. So have you had such instances, and how were you able to convince them that sometimes these herbal drugs are not good for your lungs and they are not good for you. Were you able to actually be in such situations, and how were you able to handle it? Because I'm asking this because I know people who use herbs, they're the most difficult people to convince because they always have this belief. So how were you able to handle such situations?
This is also another constant struggle that we face. People need to understand that nutrition is different from treatment. So nutrition is making sure that you have a balanced diet, and then you're eating the right things for your body. You have a reduction of sugar intake and salt intake, an increase of fruits and vegetables, which will obviously help the body, help your growth, and keep you healthier. Now, when you now have an illness or a sickness, again, this food items help with your healing process, but they are not the medicine for the healing process. When you talk about herbal medicine, I'm not against eating the right things, but when it comes to herbal medicine, the dosage and the quantity cannot be measured. Or else you have somebody who has measured the dosage or the quantity, and you can kind of do the equivalent to the medical form of it, then it becomes a challenge. If you're taking a herbal dose, you don't know who did the mixture, number one. You don't know the type of water they used, which can also cause another problem if they're using unpurified water. You don't know the quantity of the herbs that they're putting there. So I can't say, I'm not in the right place to say that nobody should take herbal treatment. However, I believe that when you do not know the quantity or the dosage that is being put inside there, that's where the challenge comes, because you may be overdosing on a particular ingredient within that, and that's where, so you may be trying to heal one ailment and then cause another. Yes, exactly.
All right. So away from that, what challenges would you say are facing the health sector? Because I think you made mention of a few in your speech, but I want you to elaborate on that.
Well, we have a number of challenges. I guess the number one everyone will always talk about is funding for the health sector. In 2001, Nigeria had made a declaration of 15% of the budgets to health, and we've never reached 15%. The other countries that we had this meeting with in 2001 in Africa, most of them have they've been implementing their 15%. We haven't even reached half of 7.5. So there is a big challenge. Even the one that the percentage that I think the current one is less than 5%, but or less than 6%. But what we're even currently given, when it's not even sure if it's been allocated to the right places. So funding is one thing. Another thing is implementation of the policies that we have. We have a lot of wonderful policy documents in Nigeria, but we have issues in implementation. So if you write a nice policy document that has good recommendation, that has good plan for improving or preventing a particular issue, and it's not being implemented, then it's really a waste of a policy. So we need to dig down and look at some of the policies we have, especially now we have a new administration. I would encourage the new administration to look at the policies that have already been approved or submitted to the Ministry of Health, and begin to look at the ones we can start to implement immediately to improve our health issues in Nigeria.
All right. So with your organization, when you're trying to carry out your duties, what areas of the FCT would you say are mostly faced with these issues of health?
I believe everywhere in FCT is faced with the issue of health, but in little clusters. So a particular local government, every local government has their own particular issue. However, it might not be the whole local government. So maybe it might just be one area in that issue. So it will not be fair to call out any local government, because every local government has their own peculiar issues. And because we have ABUJA, we have a lot of settlement areas and really rural communities. the more rural, the more health challenges you will see because of the environment, because of housing issues. If you don't have good housing structures, it will increase the health issues. If you have a family of 8 living in one room, of course we're going to have issues there because they're all clustered together. Ventilation issues. So if you have a family within a house that doesn't have good ventilation, it increases the health as well. If we have a family that have illiterate people, it's going to increase health issues because if the mother does not know how to read, she will not know how to understand the immunization schedule of the child. If she does not know how to read, if any of the children are not feeling well, she won't understand. Even if she's given a prescription at a primary healthcare center or at a pharmacy, she wouldn't understand how to administer the drugs as well. So a lot of factors come into place when you talk about health issues and how to improve them.
Because the issues that you just made mention of, I'm thinking about it. I'm thinking, what could be the solution to all of these issues that you just mentioned? Because let's take into consideration cluster. How do we take care of that? Because every single time the FCT administration does something like demolition, people come out to clamor against it. But this, what you just raised, is an issue, and that cannot be fixed without demolitions and all of that. So how do we fix these issues that you just mentioned?
Unfortunately, I'm not a housing expert, but definitely we need to provide more affordable housing for people in every state in Nigeria, not only FCT, because that would help with the... So I'm not a housing expert, so I can't tell you the plan of their ministry or their own plan. But we also have to understand that FCT is growing. It's not as... we don't have as many people like 10 years ago to now. The number of people that have entered FCT has been, you can't even measure it, So it's really difficult because when each set of people come into FCT and they find a place to settle, we have a lot of people living in uncompleted buildings as well. That alone is even scary because in uncompleted building, we have issues of not only water, sanitation, we have issues of snake bites, we have issues of other, wild animals attack, bites as well. So the issue is it just keeps going on and on. So there has to definitely be something to do with housing. But even within the communities as well, we need more of the community leaders to also begin to speak to the people that while they're even in a particular community, keeping the environment is very, very important. Ensuring that sanitation, their spaces are clean is also important to improving population health.
So what area does your organization, Silver Lining, focus on in health advocacy?
So we sit on a lot of government committees in terms of supporting policy and also trying to ensure we come up with ideas to prevent diseases such as malaria, pneumonia, and improve also the rates of immunization and other things. We are focused on a lot of outreach, so we do outreach in communities. We ensure we go and give them free health tests and sometimes provide support for treatment because many people can't afford the treatment. Maternal health is big for us, so we also support expectant mothers, in ensuring that they have the essential items they need when they're going to give birth to reduce infections to themselves and their babies.
Oh, that's beautiful. That's really beautiful. So in the course of all your outreach and all of that, are there any specific observations that you've made so far that you would like to share?
The observations we have made, we've made lots of observation, but we also, one of the things I always like to say is that we try and encourage religious leaders and traditional leaders to play a bigger role that they're currently playing. The religious leaders and the traditional leaders are the voice of the community, are the leaders of the people. And when you have a religious leader who makes a statement against immunization, his or her congregation is going to reject immunization. That is a huge problem for the households that in that community,
Okay,
you're
so
going
they
to see
tend
a
to
rise.
listen to their religious leaders or the
Exactly.
traditional leaders.
Exactly. They tend to listen to their religious, and so I always make sure that we wherever we go to, or wherever I'm asked to speak to really touch on that, the importance and the value that religious and traditional leaders play in any community or any society, because people listen to them. You know, if my religious leader tells me now not to take COVID vaccine, I'm likely not to take COVID vaccine. You know, if they tell me, oh, don't immunize your child, it's not good. Or if they talk against family planning, that's another issue. If a religious leader is coming from the point when they're not, they're outrightly saying that family planning is wrong, you know, it has its own ripple effects, in the sense that the woman would continue getting pregnant and
Giving birth to children she
giving
cannot
birth to
take care
children
of.
that she can't take care of, or her husband or cannot afford to take care of. They can't afford to pay for, you know, send them to school. They can't afford to clothe them. Then we now have the issues of almajiri children who are on the streets. We have issues of even the mother's health as well. When you're not even understanding the spacing, the birth spacing issue as well. You know, the mother's health is also at risk as well. And we can't afford to keep having women dying at childbirth, because who looks after the child? You know, who comforts the child? Who nurtures the child?
You just made mention of birth spacing. I want you to elaborate on that. Like you said some women don't even understand the importance of birth spacing. What are the importance and how should children be spaced?
Well, medically speaking, the recommendation is with 2 years gap.
Okay.
And that just gives your body a chance to repair from the first birth and then prepare for the. So again, I'm not a medical doctor, so I
But
can't
I
speak
know you
from
have
the.
lots of
Yes,
ideas.
I can't
That's
speak from the clinical aspect, but just generally speaking, you know, giving birth to a child is a very traumatic experience. Your body goes through a lot of changes, and so your body needs time to recoup before you're able to get pregnant again as well. Not only for your physical health, but your mental health as well. And then it gives you time also to bond and take care of the first baby before you start preparing for another baby. Obviously, any woman that is pregnant, we encourage to go for full antenatal. So in the antenatal, they are able to learn more from each antenatal visit about the journey of their pregnancy, and also be able to get the health professional to be able to check them as well, to ensure that their pregnancy is going through a healthy journey as well. So antenatal is something that we continuously stress, because all the answers any expectant mother needs, they will get at their antenatal.
all right. Now away from all of this issue, let's talk about the universal health care. What are your thoughts on that, and how can we place Nigeria higher on the global scale when it comes to health?
So the universal healthcare, the goal is by 2030 to ensure that we have everybody having an equal access to healthcare. I do believe that Nigeria is working towards it, and every other country is working towards it. Nobody wants to be left behind. So universal healthcare will just ensure that we have less out-of-pocket spending. So for example, you are sick, you don't have any money, so there's no money from out-of-pocket spending to help for treatment or care. But if you have some form of insurance, right now in FCT, according to statistics I saw through maybe 3 months ago, only 5% of FCT have health insurance. Now, health insurance is important because it does cover you from the basic health issues that anybody would experience. And when I say basic, we also have to remember that certain basic things that we call basic, such as malaria, is huge in another country. And this basic thing called malaria can kill people. And people, I think we take it for granted in Nigeria. And so to ensure that we do reach this UHC goal, we have to ensure that we increase the number of people that are on health insurance. And not only that, we also, again, it has to do with budget allocation. It also has to do with, it's a multi-phased effort that needs to go into ensuring that we do reach universal healthcare in Nigeria.
Oh, all right. Thank you so much. It's been amazing talking to you. But before I go, you're an advocate. So I want you to advocate about a particular health crisis that we're having in Nigeria. Something. What if you're asked to advocate against one health challenge? I know that we've gone past the stage of COVID-19, so I'm very sure it will be COVID-19. What would you be advocating for right now?
So what I would advocate for again is on immunization. Yeah,
You're so keen about
yes,
immunization.
I'm so passionate about immunization and vaccines generally. I will start by saying with immunization, which is to ensure that every mother completes their immunization schedule for their children. And then secondly, I also want to make sure that everybody who is listening to this or hears this ensures they do their regular checks. In Nigeria, we do not, in fact, in Africa, we do not have the habit of checking ourselves regularly.
No, we don't.
And we need to begin to enter the habit of once a year going through a checkup. We need to ensure that essentially for women, you need to ensure that every 3 years you do your smear test. Many women have never had a smear test before. Many women don't even know that they have cervix. You know, we had a poll a few years ago where we asked on the streets for people to tell us about their cervix, and women didn't even know they had cervix. So that's the first one. So it's really focusing on ensuring that people start taking their health seriously and making sure that they are doing their regular health checks, checking the, you know, even for women, checking their breasts regularly after the period to make sure that, you know, for breast cancer, because early detection is, you know, key in any disease. And cervical cancer is the only cancer that is curable if detected early. So we need to ensure that we begin to check, even for the men, checking for prostate as well, because these are things that are killing people. And then when you hear somebody dies and say, oh, it's from their village. No, it's not from their village. It's from negligence. So a lot of us are so negligent. We don't know what the state of our physical, our mental health. And it's really important we begin to pay attention to that. And another example I can give you is even with hepatitis. We have a real huge hepatitis B issue in Nigeria. And we need to start focusing on that. We have, as an organization and in partnership with other key organizations, been advocating for more hepatitis B testing. And once you know you've tested and you're negative, is immediately do your vaccine. It's 3 doses and it's across 3 months. Sometimes, depending on the places, they move it to 6 months. But it's just 3 doses. And it ensures that, because hepatitis is not like HIV, it's actually in many cases worse than HIV because of the contraction, the different ways you can contract it. And so this is my call to people. Take your health seriously. Ensure you test yourself regularly, once a year at least, to know the health, the situation of your health, and then, you know, help yourself by preventing things on time.
All right, thank you so much. It's been amazing talking to you. And I think I'm going home with like 1 or 2 things from our conversation. Thank you so much.
Thank you very much for having me.
All right, that was our conversation with Awa Abbas. She's a public health advocate and a humanitarian. She's also a certified coach. Until I come your way next time, I hope you learned something from this episode of ABUJA File. And bye for now.